Well, Saturday will mark 1 year since Hurricane Harvey tore through the Houston area. And despite recovery efforts, homeowners in the region are still facing issues. CBS News contributor Leslie Sanchez has the story.
Hurricane Harvey slammed the Gulf Coast, dropping 1 trillion gallons of water on Houston alone. 1 year later, public health risks remain. Preliminary research out of Harvard University, shared exclusively with CBS News, reveals families returning to their waterlogged homes may face serious health risk.
Bear in mind, the debris is off the ground, okay? So when you drive around the city, you're not going to see pretty much the impact of Harvey, okay? You literally have to go inside people's homes to see the impact.
We spoke with former EPA Administrator Gina McCarthy about the unknown risk that exists after a flood.
You can have exposures to contaminants in your home that came in with the flood water. It brings in real public health challenges about what does your indoor air quality look like after a flood? How long should you be living in that home? How do you fix it so you don't have the mold and the mildew and the damage around you? How do you keep it safe for your kids?
So where are we going?
We're going to take you to where we calibrate our sensors.
Harvard researcher Memo Cedeno-Laurent is leading a new study that uses sensors to compare the air quality of flooded and unflooded homes impacted by Hurricane Harvey. The sensors track each home's indoor air quality to check for the presence of minute amount of chemicals and other toxins invisible to the naked eye, which the floodwaters may have left behind.
People think that problems finish once the water goes away, but that's when they start for many people.
Most of the families participating in the study are still living in the homes while they're being rebuilt because they don't have other options. Nearly 2/3 of the homes damaged by Harvey were not covered by flood insurance.
I don't think people realize just how much of our world is indoors, and they think if there's an air pollution problem outside, they'll just go inside, as if we have bottled air inside. I mean, it's the same air, and we're just maybe filtering it a little.
So this is Kashmir Gardens. Is one of the neighborhoods where we have been recruiting participants for our study. After Harvey, many of these places were 3 feet underwater, so damage in some of the homes was pretty substantial.
High five. Can you give me a high five? Yeah, you can.
You want to go?
Shortly after Katisha Kinney and her family returned to their flood-damaged home, her 2 youngest children developed respiratory problems.
What did you notice that's different between your children?
When they sleeping, I was like, my baby's too small to be snoring. I never had a little baby snore before. And so that's when I took them to the doctor and tried to see why they snoring and they little, like, do I need to sleep them a different way? That's when the doctors asked me, does asthma run in my family? And I was like, no, no asthma run in my family. And then that's when they were like, well, your 2 little children have asthma.
If your child has asthma, the very last thing in the world you want is for them to be exposed in a home that's been damaged in a flood, because that mold can trigger asthma attacks.
Most Americans spend over 90% of their lives indoors. Because of a lack of ventilation, the levels of known pollutants can be more toxic inside than out. The most dangerous are fine airborne particles 30 times smaller than the width of a human hair, known as PM 2.5. Breathing air with high concentrations of PM 2.5 can have a direct impact and lead to serious health problems, including asthma, stroke, lung cancer, and heart disease.
The homes that were damaged by Hurricane Harvey, and the preliminary results you're seeing what?
We can see that concentrations of PM 2.5 and the total volatile organic compounds show very high air pollution levels, comparable to a very bad pollution day in a city like Mumbai or Beijing or somewhere else.
And that's in people's homes?
And that's inside of people's homes.
According to the World Health Organization, PM 2.5 levels above 25 are considered unsafe. Over 6 months, sensors recorded an average PM 2.5 measurement of 59. At its worst, indoor air exposure reached 400.
Were you surprised by what you saw in this preliminary data?
I wasn't expecting them to be that high. But what I'm really shocked is that really we can, even on a blinded basis, tell what house flooded and what house didn't flood, just because the difference in the levels is so stark.
The Harvard study is ongoing, with results not expected until spring 2019. Meanwhile, local officials have proposed a range of measures on how to deal with severe storms. The majority focus on flood mitigation, infrastructure improvements, not long-term exposure to indoor air pollution.
So we are having to build a city that's stronger, more resilient, recognizing that these storms are coming with much more frequency and intensity, so that they can withstand these storms when they come. Not just the storms, but the after effect as well.
In the meanwhile, flood victims like Corticia wait.